So, like I had mentioned in the previous slide, a lack of transparency violates certain ethical principles such as non-maleficence and beneficence. But as a whole, the lack of transparency violates all of them. It violates autonomy, non-maleficence, beneficence, justice, and fidelity. So, here are a couple examples. So, refusing to disclose or choosing to not disclose medical errors to patients ignores, insults, and demeans their rights of autonomy. But also, by doing that and by deceiving them, they're not really receiving informed consent because if you choose to disclose, if you choose not to disclose a medical error to them, then they're not really informed as to why you are doing additional interventions or why they have to stay at the hospital longer. And that is a violation of informed consent because they obviously aren't informed of the fact that they're staying longer. Um, and like I had mentioned, non maleficence, you're trying not to do any harm. And when you choose to not disclose a medical error, the patient might end up worrying. They might negatively impact their healing process because you refuse or you chose not to disclose this medical error to them. And so they're like worrying, and it could cause psychological distress, which could negatively impact the patient's condition. And like I had mentioned in the previous slide, beneficence is to do good. And when you fail to disclose a medical error and you let the patient assume that whatever is going on with them is due to the disease process, it's not okay and it's unkind. And for justice, it means doing something that the patient deserves. So it means doing what is fair, and that means disclosing an error. And when you don't do that, you are not doing justice to the patient because that's not what they deserve. They deserve honesty and they deserve knowing why they're here. And lastly, fidelity. When we are dishonest to patients, it undermines our reputation, but it also casts a shadow on the medical field as a whole, because if one medical professional or one medical provider was able to deceive you, then who's to say that other medical professionals won't?